Chapter 2 Biological Beginnings. Chapter 2 is about the beginnings of life. We will cover the evolutionary perspective, the genetic foundations of development, reproductive challenges and choices, and lastly, how heredity and the environment interact. The evolutionary perspective is another theory. We just didn't talk about it in the first section because I wanted to explain it more here. So this would kind of fall within maybe between biological and social theories. Um, this perspective seeks to identify behavior in today's humans that is the result of our genetic inheritance from our ancestors. So this field grew out of the work of Charles Darwin, who argued in The Origin of Species that a process of natural selection creates traits in a species that are adaptive to their environment. Natural selection is the process by which those individuals of a species that are best adapted are the ones that survive and reproduce. For example, mice. So here you see on this chart, we have two different colored mice. One color that sticks out on the land and one color that blends in on the land. So you see that the bird um, ate some of the mice in the second picture, but we have more mice that blend in that survived than the ones that stand out survived. So then what happens here is you have three gray mice, two white mice, and whenever they all mate and have babies, you're going to have more mice with the gray genes because there's more of those mice. So then the next picture, when we repopulate, you see we have a lot more gray mice because the gray mice are the ones that survive and they're the ones that can reproduce and pass on their genes. So their offspring looks like them, and slowly, we have less and less white mice because they don't survive. The hawks can eat them faster. So that's natural selection. So there's some kind of trait you have that helps you survive, and those um, that part of that species is going to be the one that lives on, reproduces, and passes on their genes. Another term in your book is adaptive behavior. This refers to behavior that promotes an organism's survival. So we're not talking about a trait, like a physical trait would be the color of the mice fur. Adaptive behavior is talking about an actual behavior that the animal or person would display. So, for example, if we're talking about humans, the behavior of being creating attachments between a caregiver and a baby would be adaptive because that attachment ensures the infant's closeness to the caregiver, which provides food and protection from danger, which increases the infant's chances of survival. So if a baby wasn't so cute, basically, with the smiling and cooing and crying out for the caregiver may not be as attentive, which would mean the baby has less chance of survival. So that's an adaptive behavior. So essentially, what this theory, evolutionary theory, is suggesting is that not only are physical traits genetic, so we already know that like your hair color, your height, those kinds of things we know are genetic. You get that from your parents. But this theory is also saying that our other traits, such as your personality and social behaviors, are also genetic and inherited from your parents and your ancestors. So, for example, evolutionary developmentalists would suggest that behaviors such as shyness and jealousy are produced partially by genetic causes, presumably because they helped increase the survival rate of humans' ancient ancestors. So, you think about jealousy, for example, what kind of benefit would that have to your ancestors? If you think back, this isn't accurate, but it helps you to know what I'm talking about. If you think back, like caveman, in air quotes, times, and those are the ancestors we're talking about. So why would jealousy be important for survival? Um, well, if you had a mate at that time, and let's just say from the female perspective, um, you you would be more reliant on your mate to provide for you and your offspring. If your mate goes off with some other woman and leaves you without any money or food or money, survival, anything to survive with, then you're less likely to survive. Your child is less likely to survive. So if you develop these feelings of jealousy and you act in ways that display jealousy, that's basically mate retention. You're trying to keep your mate close to you, and keep him with you and your child so that you can survive. So then that might be why jealousy developed as a trait or as a feeling that we see now. That's essentially the gist of the evolutionary perspective. So your textbook talks about genetics and chromosomal abnormalities and all that kind of stuff. It's essentially just a review from biology. So I'm going to let you read about that on your own. And we're going to skip ahead to talking about reproductive challenges and choices. So the first one we're going to talk about is prenatal diagnostic testing. So there's been over the last several years, decades, there's been an explosion of knowledge and technology that has led to a lot of choices for parents whenever they're expecting to have a child. So the first one is prenatal is exactly how much prenatal diagnostic testing the prospective mother should undergo. So these tests are all used to just see if the fetus is developing normally, but there's several different kinds of tests, and you don't necessarily have to get all of them. Some of them are only for certain situations, people who might be more prone to certain difficulties giving birth. Some of them might be dangerous. So that's one of the first things that parents have to decide is how much of this testing do they actually want to have. So the first one you've probably heard of, which is just an ultrasound. Um, the ultrasound is usually conducted several times throughout pregnancy. It's pretty common, and it can determine how many fetuses are present, give clues to the sex of the fetus, and detect many structural abnormalities. This is a picture of an ultrasound output right here. So you can see that you would be able to tell if there was more than one baby. Eventually, you might be able to tell what the sex might be, and you might be able to see if, for example, something was wrong with limb development, if there was only one leg or one arm, if something was wrong, the head was deformed. Those kinds of things can be seen in ultrasound. So those are safe and pretty common. So if you're using an ultrasound and you do detect an abnormality, then you would do a different test, which is called a fetal MRI. And this can be used to get better pictures of the fetus, essentially. Um, so if you think something's wrong, you would just want to get a more clear picture of what's actually going on, and for that, you would use the fetal MRI. There's another option which is called chorionic villus sampling. This is a test that can detect the genetic defects and chromosomal abnormalities that are discussed in your textbook. So you might get this test if you know that your family has a history of Down syndrome. You might want to get this test usually between 9.5 weeks or 12.5 weeks of pregnancy to see if your fetus tests positive for this. You can also get a maternal blood screening, which is performed between the 16th and 18th week of pregnancy. And this identifies pregnancies that have an elevated risk for birth defects, again, such as Down syndrome. Um, but some of these tests do pose risks for the mother and the fetus. It may cause miscarriages. Um, but another issue you might consider is the ethical one. So being able to determine if your child is going to be male or female, if your child is going to have a certain disease or defect, may raise ethical concerns about the couple's motivation to terminate a pregnancy. So normally we would have a discussion about this in class, but since we can't, this is just kind of the main idea just to think of on your own is if you were in that situation, if you had one of these tests and you found out your baby was going to be born with Down syndrome, would you decide to still have the baby or would you terminate the pregnancy? And that might not be as straightforward as you first think. You may have parents who find out they're going to have a baby that has severe physical deformities that require a lot of money to take care of, whether to treat or to just accommodate their home, and that they might not have. They might not have the resources to take care of a child in that condition. So it's up to them to decide what's the best route to do. But it's a hard decision, and having this knowledge can be a good thing, but can also be a bad thing. You might also think about if you have this knowledge, who else has access to your healthcare records, and how that might affect the child later in life. So I'm going to have you watch this video for one of your assignments this week. We're not going to watch it now in the lecture, but you can watch it on your own when you do the assignment. And it just goes over gene editing and some of the issues I just brought up, so you can think about that more in depth. So moving on with reproductive challenges and choices, the next thing we're going to talk about is infertility. So recent advancements in biological knowledge have also opened up many choices for infertile individuals. So in some cases, the causes of infertility may be corrected with surgery or hormone-based drugs, but there are also other options if fixing the issue isn't available. So many people try high-tech assisted reproduction. The most common technique is IVF, which you've probably heard of. That stands for in vitro fertilization. So this technique consists of combining the egg and the sperm in a laboratory dish. If any of the eggs are successfully fertilized, then at least one of them is transferred into the woman's uterus. There are some other options discussed in your textbook, but that's the only one we're going to cover just because that's the most common. There are other ways you could do it as well where you have a surrogate mother where you maybe combine the sperm and egg and then put it in another woman's uterus because the biological mother can't carry the child. You also have sperm and egg donors where you get somebody else's sperm or egg and use that combined with yours to make a child. So there's lots of different ways to go about it, but the IVF is the most common. And then, of course, adoption is another option for people who are infertile or people who just prefer to adopt rather than have their own biological children. So your textbook talks about some studies. I just want to mention real quick about the effects of adoption on children. So research has found that while adopted children fare better than those in long-term foster care or institutions, adopted children are at higher risk for aggression, anxiety, depression, and attention problems. Internationally adopted children had a higher level of mental health problems. However, overall, most children adjust well after being adopted. One study in China found that infants' cognitive development improved 2 to 6 months after being adopted from foster homes and institutions. So think about why they might have found that result. That infants' cognitive development improved 2 to 6 months after being adopted from foster homes and institutions. So a big reason for that is the individual care. So they're getting that nurture, the nurture we talked about in the beginning. We talked about Erikson and his stages and mistrust versus trust. So they're getting the warmth, they're getting the attention, the food, the social development. They're getting all of that one-on-one care. Whereas in a foster home, they're being taken care of by maybe one person who's in charge of 10, 15 kids, maybe more. So they're not getting individual personalized care. So those things are directly tied to each other, your physical development and your cognitive development and your social development. So that's why you see the increase there. So over the course of this chapter and in this lecture, um, we've been examining parts of the nature and nurture debate. So we talked about how the environment exerts selective pressure on characteristics of species over generations. You, in your textbook, read about how genes are passed from parent to child, and then we discussed the effect that reproductive technologies and adoption have on the course of children's lives. In all of these situations, heredity and the environment interact to produce development. Behavior genetics is a field that aims to study the extent to which people differ because of differences in their genes, environment, and a combination of the two. They do this through twin and adoption studies. So, for example, a twin study found that identical twins were more prone to conduct disorders than fraternal twins. They drew the conclusion that perhaps conduct disorders are more connected to genes than the environment. In adoption studies, investigators seek to determine if the behavior and psychological characteristics of adopted children are more like their biological parents or their adopted parents. The heredity-environment correlation means that individuals' genes may be systematically related to the types of environments to which they are exposed. Basically, individuals may inherit seek out or construct environments that may be related to genetic propensities. There are different types of correlations here. So the first one is passive correlation. This is common at young ages when children have no control over the environment in which they're exposed. So passive correlation might be something where the parent provides environments influenced by their own heredity. And then compare that to the evocative correlation. This is where children evoke responses that are influenced by the child's heredity, and these responses strengthen the child's original style. So for example, if you have an active, friendly baby, um, they might have their parents probably were very active and friendly, so they may have that friendly gene. And when the baby, just think about if you see a baby that's happy and smiling and laughing, how do you respond to that baby? You're probably happy and smiling and laughing back. So they are evoking that response from you, and they're kind of changing their environment based on their own heredity. Um, so let's think about an example for passive correlation. So let's say that you have a child whose parents like to read, and they read to her a lot and they provide her lots of books. So that would be a passive correlation because the parent is providing that environment based on what the parent likes. So the parent likes books, they are probably maybe smart, maybe they just like to read, and they have filled the child's room with books and make sure that they read to her and those kinds of things. So that would be a passive correlation where the child had no control in that situation. Um, so those are the differences between those. And then you also have active correlation, which is common at older ages. And this is when children extend their experiences beyond the immediate family and are given the freedom to make more choices. So this is where they're actively seeking out environments that fit with their genetic tendencies. This is also referred to as niche picking, the tendency to choose environments that complement our heredity. So let's say that you grew up in a home of musicians. So you started with passive correlation where maybe your dad plays piano. So you kind of grew up around music and you didn't really choose that, but that's just something there. But also you were born with a music gene, if that was a thing, where you were talented at music as well. And then as you get older, maybe you don't like piano, but you really like playing guitar. So you start seeking that out, and you get a guitar and start learning how to play guitar. So you kind of move through those as you get older, and basically it's just about how your genetics and the environment that you're in interact with each other. Okay, and lastly, we have the epigenetic view. So this view emphasizes that development is the result of an ongoing bidirectional interchange between your heredity and the environment. This is different than the heredity environment correlation view because in the epigenetic view, heredity and the environment both influence each other. In the correlation view, heredity influences the environment. So the one we just talked about, it's one way. In the epigenetic view, it's both ways. So your environment influences your heredity influences your environment. Okay, so you can read more about this in your textbook, but that is all I have for you for chapter 2.